They say hospitals are places of healing, but no one ever talks about the things that stay behind, the things that refuse to let go. What if the walls could remember pain? What if grief was a presence that followed you even after death? This story isn't just about a haunting. It's about guilt, memory, and a truth I can't unsee. It was a late Thursday afternoon in October, that odd hour where the light turns gray through the windows and the halls go too quiet. I was working a double shift on Psych Med at St. Veronica's, a small hospital tucked just outside the city. We were understaffed, again, and I had a full board, mostly behavioral cases and detox patients. I remember I hadn't even had my coffee when the first strange thing happened. 3 days earlier, we discharged a patient named Daniel Reyes. He was 46, admitted for auditory hallucinations and severe insomnia following a near-fatal overdose. A soft-spoken man with deep, haunted eyes and a voice barely above a whisper. His chart said schizoaffective, but he told me once quietly that something followed him back from the night he flatlined. He had coding scars along both wrists and one on his chest from the crash cart paddles. But he was doing better. At least we thought so. Psychiatry cleared him for discharge after he made 48 hours without an episode. The plan was outpatient follow-up and a transfer to assisted housing, but less than 24 hours after he left, we got word from the coroner. Daniel was found dead in his apartment, alone. Cause of death, cardiac arrest. The kind they said looked like spontaneous heart failure. No signs of relapse. No drugs. Just gone. The room he stayed in, room 9B, hadn't been touched since. I was reviewing medication logs at the nurses' station just down the hall, when Jerome, one of our environmental services guys, came up looking rattled. Jerome worked the night shift longer than I've been a nurse. Big guy. Ex-military. Steady hands. So when I saw him pale and sweating, I stood up immediately. He asked me, voice shaking, Is there supposed to be anyone in 9B? I said no. It was empty, pending deep clean. He nodded, stared at the floor, then said, I just saw someone in there. Looked like a patient. Where's for a single frame of footage? Exactly 2 seconds. The hallway lights behind him went black. The frame glitched, and a silhouette flickered into view. Not walking, just standing there. A man-shaped shadow, like someone frozen in a scream. I thought about what Daniel had said his last night. About how when he was dying, he felt a hand pressing down on his chest. How he heard a voice say, You don't get to leave yet. Over the next few weeks, things got worse. Room 9B became a black hole on the unit. Vitals monitors would malfunction when wheeled past it. Patients in nearby rooms started complaining. One woman detoxing from fentanyl told me, The man with no eyes keeps looking through the window. There is no window in 9B. Another nurse, Eliza, refused to do rounds near that hall anymore. She said she heard whispering coming from the locked room. Sometimes crying, sometimes laughter that wasn't human. But the part that broke me, that still won't let me sleep, happened 2 weeks later. I had just clocked out, walking to the elevators, when I heard a soft voice behind me. Miss, you forgot to check my vitals. I turned around. Empty hallway. But I swear to you, I recognized that voice. It was Daniel. That was 8 months ago. Room 9B was officially sealed off for asbestos remediation, but everyone on the floor knows that's not the reason. Staff refuse to speak his name, but sometimes, on the night shift, I still see it, flickers in the corner of the CCTV, a movement in the shadows near that door. Some things follow you, and some rooms are more than just empty. They're waiting. Hey friends, thanks for tuning in. A huge shout out to our amazing subscribers. You are the reason these chilling tales keep coming to life. If you are enjoying the spine-tingling stories, consider hitting that subscribe button. It only takes a second, but it means the world to us. While you are at it, don't forget to like and share to keep the chills spreading. We appreciate you more than you know. See you in the next one, if you dare. Some memories don't fade. They wait. They whisper. They return when you're alone with the lights off. I've worked in psychiatric care for over 22 years. Acute psychosis wards, locked forensic units, trauma recovery centers, you name it. Over time, you develop a sixth sense. You start distinguishing between delusion and trauma, between medication side effects and buried grief. You even get used to the strange. But once in a while, once in a long while, something walks into your life that doesn't fit the manual. Something you don't talk about in clinical notes. Something that rewires how you sleep. This story began 8 winters ago. A patient was transferred to our facility under a veil of vague reports and urgent signatures. We called her Eloise. Not her real name, but I doubt it matters anymore. The referral said, quiet, nonviolent, severe dissociative symptoms, probable schizoaffective traits. But that didn't prepare us. Nothing could. She arrived on a snow-heavy Thursday, tall, elegant posture, skin pale like faded parchment. She didn't speak at intake, just stared. Not confused, not afraid, just aware. Her eyes were the first red flag. Too dark. Not just brown, obsidian. And during day shifts they seemed normal enough. But every night, during rounds, her pupils didn't respond to light. I adjusted first, flashlight in hand. I'd shine the beam in her direction. Nothing. Eyes wide, glassy, too still. One night I saw her reflection in the mirror above her bed. The whites of her eyes were gone, just 2 holes. Black, bottomless, ink spilling where her soul should be. She didn't react to her meds. She followed every order. But the staff didn't feel safe around her. Not because of aggression, but because of the way she watched us. Like she was cataloging weaknesses. She'd sit in the common room, hands folded, staring with this knowing expression. I've seen schizophrenia, mania, catatonia. Eloise was none of those. Eloise was awake in a way we weren't. Then the whispers began. It started with Marcus, our night orderly, 15 years in psych work. Hardened, reliable. One morning, he clocked out early, sweating, shaking. Said Eloise had whispered something to him at 3:14 a.m. His grandmother's name. The one who raised him. The one who died in her sleep when he was 12. She whispered the exact words she used to sing to him, to calm his night terrors. A lullaby in Hungarian. Marcus doesn't speak Hungarian. He quit that week. We started documenting. Not in the charts, those were useless now, but in whispers behind medication carts and cold coffee cups. Sarah, our most seasoned nurse, claimed Eloise told her what her father used to call her during his drinking fits. Mouse. A name Sarah hadn't heard since she was 9. Dr. Fleming, our head psych, had a breakdown in the staff bathroom. Claimed Eloise said the phrase, "I never forgave you for leaving the lake house." His daughter drowned at that lake. He hadn't spoken of it in over a decade. Not even in therapy. I made the mistake of staying late one night. I wanted answers, so I brought a chair into her room, sat down at the edge of her bed. The light flickered above us. My voice felt like it didn't belong in the room. "Eloise," I asked, "why do your eyes turn black at night?" She turned her head toward me, slow, mechanical. Her mouth twitched at the corners, like a smile that didn't belong to her. "Because that's when the others come close," she said, "and I need to see them clearly." I didn't speak. My body froze. Every nerve in my skin screamed that I was being watched, not just by her. "They talk," she whispered, "and some of them ride home with you." Then her eyes, those voids, locked onto mine. "There's one behind your door. You hear it too, don't you?" And I did. I had. For weeks, I'd been hearing something scratching at my apartment door, just past midnight. Not rats. Not the wind. A slow, deliberate dragging, And the dreams. Those had started too. Dreams of my mother, dead 10 years, whispering, "Don't open it," over and over. Eloise never left her room. We checked the cameras, never used the phones, never accessed any files. But she knew us. 2 weeks later she vanished. That's the only word for it. One morning, her room was empty. No transfer paperwork. No transport logs. The surveillance footage glitched between 3:13 and 3:15 a.m. A full blackout. Security swore no one entered or exited. Her bed was still warm. Her shoes were gone. Her patient bracelet sat on the floor. A memo came through the next day. Patient discharged to private care. Do not pursue. Signed by a director who'd retired 3 years prior. But that wasn't the end. Last month, I got an envelope at my home. No return address. Just one thing inside. A photo. Black and white. Grainy. A room. 5 beds. 4 patients. The 5th bed empty. A handwritten note on the back. "You were always the 5th. She's still watching." You don't last long in psychiatric nursing unless you learn to distinguish symptoms from something else. Sometimes it's delusion. Sometimes it's trauma. Sometimes it's something no textbook can prepare you for. This happened during my 4th year at an inpatient psychiatric rehab facility, tucked deep into the Pennsylvania woods. It was the kind of place that used to be a tuberculosis sanatorium. Long halls, peeling paint, and cold that settled into your bones by mid-October. We housed everyone from chronic dissociatives and treatment-resistant schizophrenia to high-risk PTSD and recovered cult members. And like any psych ward, there were incidents, screams in the night, self-harm attempts, violent outbursts. You learn to normalize that. You build a clinical lens that lets you separate psychosis from pattern, hysteria from meaning. But then came Eleanor. Not her real name, but close enough. She arrived mid-January, mid-50s, Eastern European descent. Quiet, composed, almost unnervingly still. She was transferred after a failed court-mandated stay at a forensic unit. Her chart was full of diagnoses: schizoaffective disorder, religious delusions, obsessive guilt ideation. No criminal record, but a history of running away from facilities, never violent. No restraints needed. Her meds were simple: low-dose aripiprazole, clonazepam. At night, med-compliant, no obvious hallucinations, just something off. And I don't mean clinical, I mean spiritual, existential, like she knew something none of us wanted to admit we believed. She didn't speak much, but when she did, it was always intentional, and always at night. Every time we brought in a new nurse to the night shift, only the night shift Eleanor would wait until they were alone. Never during group, never in the med line. Always when the halls were still, a shadow in the hallway, a silhouette near the rec room window. And then she would whisper, "You left her there, didn't you?" Every time, just those words. No name, no context, just enough to shatter the stillness. At first we thought it was echoing, a scripting behavior, something she'd heard and internalized. We even joked that it was her ghost line. Staff laughed it off during shift change. But the new nurses never stayed. Never. Then came Rachel, a travel nurse from Portland. Early 40s, mother of 2. She was confident, funny, a seasoned psych nurse. She even joked when I warned her about Eleanor's little hallway habit. "I've seen worse," she said. "Patients in Oregon used to spit blood on your shoes for fun." Her first shift was a Friday. Her second was her last. I arrived Saturday morning, and Rachel was already in the staff parking lot, chain smoking with her suitcase at her feet. She didn't even wait for a goodbye. "I'm done," she said, voice flat and distant. "I'm going back west. I won't work nights again." I assumed a patient had been aggressive, but when I pressed, her hands shook and her eyes darted like someone afraid of being overheard. "I didn't tell anyone what happened in Detroit," she whispered. "No one here knows. No one should know. But Eleanor." She looked at me, and I swear to God, it wasn't her voice. She said, "You left her there, didn't you?" And I knew what she meant. Turns out, Rachel had worked on a pediatric trauma ward. 3 years earlier, a girl under her care died in restraints. It was ruled accidental, but Rachel never recovered. She'd moved, changed agencies, scrubbed her name from public records. No one here knew. No one could have known. After Rachel left, I dug into Eleanor's chart, trying to be rational, looking for clues, any mention of that phrase, any linguistic pattern, any indication of suggestibility or mimicry. Nothing. The phrase didn't appear until her 3rd week here. The timing was specific. It coincided with the arrival of another nurse, Priya, who also quit without notice after 3 shifts. We'd had 5 nurses leave in under 2 years. All had secrets. None had been documented. Eleanor only said the phrase once to each person. She never repeated it, never explained herself. When asked in therapy why she said it, her reply was always the same. "I only say what the room tells me." The room. We didn't understand that part until months later, during a renovation of the south hallway. A construction crew tore down an old maintenance door. Behind it, they found a walled-off room, maybe 10 by 10, no windows, rotted cot inside. A single chain bolt on the floor. Old patient wristbands. One of them still bore a name, faded, but legible. Mira. That same name appeared in Eleanor's early notes from her first hospital. The one she escaped from twice. Mira. A girl who'd been under Eleanor's care. She died during a winter lockdown. Forgotten in seclusion. The story had been buried under staff turnover and administration change. No charges were ever filed. But Eleanor remembered. She remembered everything. So now, I don't know what to believe. I still work here. The room is sealed. The whispers have stopped for now. Eleanor no longer speaks at all. She just sits by the window staring out at the tray line. Sometimes I catch her mouthing words silently, like a prayer or a warning. I've reviewed her file hundreds of times. I've told myself it's all projection, micro-expressions, guilt recognition, maybe a sophisticated form of trauma bonding. That makes sense, but sometimes late at night, when I walk those halls, I swear the air hums with something colder than fear. And sometimes I think, maybe Eleanor wasn't the messenger. Maybe she was the receiver. And maybe, just maybe, the room is still whispering, waiting for its next confession. We admitted Elena Mora to the unit after a failed suicide attempt. An overdose discovered just minutes before cardiac arrest. 28? No prior psychiatric history. On paper, she looked like an outlier. But the moment I met her, I knew she'd been carrying something, not trauma, not madness, something ancient and watchful. Her manner was quiet, polite. She followed the routine like muscle memory, took her meds, sat silently through group therapy. But she was never really with us. She was watching, not with paranoia, not with fear. It was more like calculation, like she was keeping track of a game the rest of us didn't know we were playing. That first week, she didn't speak much, until one night, as I charted notes at the nurse's station, she appeared without a sound, just stood there, her gaze fixed on something far behind me. "Elias," she whispered, "room 9, don't let him be alone tonight. It's already too close." I assumed she meant Elias R., a paranoid schizophrenic, recently stabilized after a violent psychotic break. I nodded, reassured her of the 15-minute checks, told her he was safe. But I stayed past my shift that night. At 2:17 a.m., Elias gouged out his own eyes with a sharpened plastic comb. We got to him in time. His body survived. But his mind, something left that night, and didn't come back. At first I thought it was coincidence. Elena never expressed emotion when she warned us. No urgency, no panic, just flat certainty, like she was describing the weather. 3 days later, she told an orderly, "The girl in 2A needs to be moved. It's found her." The orderly laughed her off. The girl, Zara, had been showing marked improvement, laughing even. That night, Zara attempted to drown herself in the toilet, held her face down for long enough to slip into hypoxia. They found her during morning rounds, lips blue, eyes open. That was when I started keeping a personal journal, not the official clinical kind. Just names, dates, and the things Elena said. Nothing in the DSM could explain it. No medical chart could hold what I was beginning to see. The pattern was impossible to deny. He's fading. She's next. It's standing at his door. Always just enough to make us tighten checks, shift meds, station a tech nearby, and always, something happened. A seizure, a break, a suicide attempt. Never wrong. Not once. I brought it to the head psychiatrist, Dr. Lynn Morell, decades in practice, Harvard trained. She read through my notes and said what you'd expect. Elena was hyper-observant, picking up on micro behaviors we all missed. Tiny cues, non-verbal cries for help. Maybe her trauma made her hypersensitive. It sounded plausible, but deep down I knew that wasn't it. One evening, after we flagged a patient for closer watch based solely on Elena's quiet warning, I asked her directly, "What do you see? What tells you?" She didn't answer for a long time. Then, without looking up, she said, "It's not them I see. It's what follows them. It knocks once, twice, and then it waits. It always waits." That was the first time I felt true cold in that room. Not from the AC, from inside my spine. The next week, she went silent. Wouldn't speak, wouldn't eat, just stared at the doors. Her drawings started changing. No longer people, but shadows with long arms and no faces, standing in corners, under beds, behind mirrors. I once held one up to the light and saw she'd carved faint tally marks into the paper. Each figure had 2 beside it, 2 knocks, always 2. One morning she didn't come to breakfast. Her room was cold, not empty, just cold. She was standing in front of the mirror. Her eyes didn't find mine. She only said, "It knocked for me last night." We removed anything she could use to harm herself. 24-hour observation. But she didn't try. She didn't move much at all. A week passed. Then one night, around 3:30 a.m., every patient in the West Wing began screaming. Not like fear, like mourning. Staff flooded in. We found nothing at first, until we checked Elena's room. The mirror she always stood before had shattered from the inside. She was gone. Not escaped, just gone. No alarm, no door opened, no window broken. Her room sealed shut. The air smelled like rust and ozone. There was only a drawing left on her bed. A circle of beds with all our patients inside, and a tall, faceless thing standing just outside each one. 2 tallies carved beside every bed but one, mine. We never found her, no trace, no body. Security footage skipped from 3/29 to 3/41. In the years since, strange things still happen on the ward. Patients speak of things knocking in the walls. Staff hear whispers when no one's nearby. A few have transferred out after waking up with someone else's face in the mirror. I still keep Elena's journal, still add names when patients suddenly break without warning. Some nights, I swear I hear it too. One knock, then another, and I wait. Because if it comes for me, if it ever comes, I want to be the one who sees it first. Some people recover, some people leave, and some of us become the ones who hear the knocking. Thank you all for being a part of these journeys with me. Your continued support truly means the world, and I absolutely enjoy reading your comments, especially when you share your own experiences and reactions. If these tales had you holding your breath or sent a chill down your spine, don't forget to give this video a like and subscribe for more eerie and unsettling stories. Have you ever gone through something similar, or do you have your own mysterious encounter to share? Drop it in the comments. I'd love to read it. Every story you share helps deepen the connection in our growing community of horror lovers. There's more to come, so stay close for more chilling tales. And remember, the most terrifying stories are often the ones that feel a little too real. Thanks again for watching, and I'll catch you in the next video.